Welcome. Today's topic, it's me again, Cyrus Kabosha. So today we are going to look at stomatitis in medicine. So how can we define stomatitis? Stomatitis, this is just the inflammation of the mucosa membrane of the mouth. So that is stomatitis. This is just the inflammation of the mucosa membrane of the mouth. It can be caused by many different diseases of the mouth. So what are some of the various types of stomatitis? One, we have a simple catarrhal stomatitis. 2, Vincent stomatitis. 3, Monilia stomatitis, and 4, hepatic stomatitis. So there are 4 types of stomatitis. 1, we have a simple catarrhal stomatitis, Vincent stomatitis, Monilia stomatitis. This Monilia stomatitis is also called hollow thrush. So we also have hepatic stomatitis. So that makes 4 types of stomatitis, and then we are going in details to look at these types of stomatitis. So let's look now at simple catarrhal stomatitis. So simple catarrhal stomatitis, this is also known as stomatitis erythematosa. So simple catarrhal stomatitis is also known as stomatitis erythematosa. So how can we define this? We can define simple catarrhal stomatitis as this is the inflammation of mucosa of the mouth with increased flow of mucus and exudate. This types of stomatitis is common in children. It mainly affects the gums and the tongue. Occasionally, you may see someone on the lips, the redness on the lips, cheeks and palate and so on. That is stomatitis erythematosa. So let's look at some of the causes of this simple catarrhal stomatitis. One, it could be microorganisms such as bacteria. So any types of bacteria, once it goes in the mouth, it can cause this simple catarrhal stomatitis. It could be poor oral hygiene. So to those people who don't like brushing the teeth, so this can lead to simple catarrhal stomatitis. So poor oral hygiene, neglected mouth, this can cause stomatitis. Another, let's look at hot food or spiced food. So eating food that is hot, it can irritate the blood vessels that are found in the mouth, hence leading into stomatitis. So another is smoking. Smoking can also cause simple catarrhal stomatitis in such a way that smoking, example I can give is nicotine. Nicotine constricts the blood vessels. So once the blood vessels is constricted, hence there will be no good flow of blood, hence resulting to stomatitis. Another cause, it could be foreign bodies in the mouth. So when let's say for example there is a stick or a grass in the mouth, it can injure the mouth, hence leading into uh, simple catarrhal stomatitis. It could be strong acids and alkali. This can also cause simple catarrhal stomatitis. It could be also systematic infection such as HIV. When you look at HIV, there is low immunity. Hence, any bacteria can invade the mouth, causing simple catarrhal stomatitis. So let's now look at some of the signs and symptoms of this catarrhal stomatitis. So one, it could be fever. This is due to the presence of bacteria in the bloodstream. It could be redness of mucous membrane. Like I said before, you could even see a person redness of the ribs. So that is stomatitis. But I'm not talking about those alcoholics people. Those usually may be caused by cachaça or something like that. So another thing is the sores in the mouth. So that is another sign and symptoms. Also pain in the mouth, it's also sign and symptoms. Dry mouth, loss of appetite, and craving for cold drinks. So that's under simple catarrhal stomatitis. So let's look at another types of stomatitis. So the second is Vincent stomatitis. So Vincent stomatitis, this is more severe than simple catarrhal stomatitis. Take note of that point. So in Vincent stomatitis, there is severe inflammation of the mouth and the gums caused by the bacteria infection. In this type of stomatitis, there is severe inflammation of the mouth and the gums. When you look at in a simple catarrhal stomatitis, there were no inflammation of the gum, but in this type there is inflammation of gum. So Vincent stomatitis is also considered as severe gingivitis. So take note of another this point. They most ask this question. They may ask you like, what's the other name for Vincent stomatitis? So Vincent stomatitis is also called severe gingivitis. So let's look at the causes of this severe Vincent stomatitis. So bacteria. Also in this type, there could be bacteria in the mouth. It can cause Vincent stomatitis. It could be poor oral hygiene. So neglected mouth, those who don't brush their teeth, it can lead into Vincent stomatitis. Immunosuppression, like I said before, in HIV patient, those people, their immunity is low, so there is a high chance of getting infected with this Vincent stomatitis. Poor nutrition, such as the deficiency of vitamin B12, iron, and vitamin C. These promote blood circulation. So when there is a reduction in this, it can lead to Vincent stomatitis. So another is smoking. Smoking, like I said before, it constricts the blood vessels, hence a patient can have this Stomatitis. So that's hand and the causes. The sign and symptoms of this Vincent stomatitis, it could be pain in the mouth, swelling or the affected part, bleeding from the gums, redness or the mucous membrane, bad taste. When you when you give this patient who is suffering from Vincent stomatitis, when you give him the food, you find that you can give him sweet food, but to him uh, it may sound bad. So halitosis, this is just a bad smell. Fever due to the infection. So that are some of the signs and symptoms of stomatitis. So when you look at the diagram of Vincent stomatitis, I don't know how I can show you. So the diagram, it looked like this one. Unfortunately, I can't show you well the diagram. So I'm sorry, as for the diagram, I can't show you well. So let's just look at another type of stomatitis. So we have talked about simple catarrhal stomatitis, Vincent stomatitis. So now let's look at the third one, which is Monilial stomatitis. So Monilial stomatitis is also called hollow thrush, like I said before. So Monilial stomatitis, this is a mouth infection which is caused by the yeast-like fungus which is called Candida albicans. So Monilial stomatitis, it is the mouth infection which is caused by the yeast-like fungus, which is caused by fungus called Candida albicans. It is a mycosis, or it is a fungal infection of the Candida species called Candida albicans on the mucous membrane of the mouth. So this type of stomatitis is caused it's specific, this one, it's caused by the fungal infection, unlike those unlike the simple catarrhal stomatitis and Vincent stomatitis. Those can be caused by the bacteria, but as for this one, it is specific. It is caused by the fungal infection, which is Candida albicans. It is caused on the it can cause infection on the mucous membrane of the mouth. There's various names of this Monilial stomatitis. One, it can also called hollow candidiasis, or candidosis, or moniliasis. So those are various types of Monilial stomatitis, and this can be classified into two. So Monilial stomatitis can also be classified into two classifications. So one, we have primary hollow candidiasis. This classification is confirmed to the mouth and the perioral tissues. So primary hollow candidiasis, this type is just confirmed to the mouth and other tissues. Secondary hollow candidiasis, this now involvement of other tissue and other body part and other body parts. So in primary hollow candidiasis, the thing that is infected is just the mouth and other tissues. But when you look at in secondary hollow candidiasis, there is involvement of other body part and other organs. So what are some of the predisposing factors for this monilial stomatitis? The first factor is lowered immunities. Like I keep on saying, on HIV patient, their immunity is low. So this albicans candidiasis, this Candida albicans can easily invade that patient because that patient has a low immunity. Another predisposing factor is in prolonged use of antibiotics such as tetracycline or chlorpheniramine. Because when you look at these antibiotics, tetracycline and chlorpheniramine, the normal flora, they clear the normal flora in the GIT. So when they clear this normal flora, this normal flora can help to fight this fungi infection. But when they are being cleared, the one can predispose to this monilial stomatitis. So what are some of the signs and symptoms of monilial stomatitis? So one, we have dysphagia. This is difficulty in swallowing, hoarseness of the voice when trachea and larynx are involved. Because we have looked like we have looked like in secondary there is involvement of other organ. So the trachea and the larynx may be involved. So it can lead to hoarseness of the voice because the larynx have been inflamed, and it can lead to dysphagia, difficulty in swallowing. It can also lead to bad taste, redness of the mouth, and so on. That are signs and symptoms of monilial stomatitis. So let's look at the last one, which is called hepatic stomatitis. Hepatic stomatitis. It is a contagious viral infection of the mouth that causes ulcers and inflammation. It is common in children of age between 6 months and 5 years. So the causes of this is herpes virus hominis or herpes simplex 1. So what are some of the signs and symptoms of hepatic stomatitis? One, it could be blisters in the mouth or tongue or cheeks, dysphagia, also difficulty in swallowing, decrease in food intake even when the patient is hungry, fever which may occur 1 to 2 days, pain in the mouth, swollen gums, ulcers in the mouth, tongue or cheeks. So that's end on the types of stomatitis. We have looked, there are 4 types of stomatitis: simple catarrhal stomatitis, Vincent stomatitis, monilial stomatitis, and hepatic stomatitis. So don't forget also remember other names of stomatitis. So I end here. My name is Cyrus Gabosha, and thanks for your time.